So there were 94 Spitz tumors included in our clinical validation studies. Accuracy was 90% or better by comparison to histopathologic diagnosis of expert dermatopathologists, and about 100% by comparison to clinical outcomes. Now, there are only a handful of spitzoid neoplasms with clinical outcomes in those validation studies, but that's been true of virtually every study of every diagnostic methodology in Spitz tumors. The reason for that is that neoplasms that are genuinely spitzoid and genuinely ambiguous, and by that I mean, let's say, 10 out of 10 dermatopathologists would examine the case and say, that is spitzoid, and I'm very uncertain about whether it's benign or malignant. Of those cases, a very, very small percentage of them ever produce unequivocal evidence of malignancy in the form of distant metastasis and or death of the patient due to disseminated melanoma. That's very fortunate for all of us, especially patients, but it complicates the validation of diagnostic methods because so few of those cases have unequivocal evidence of malignancy. Now, in the clinical setting, we have tested more than 4,000 Spitz tumors. 2,000 of those approximately were submitted with a pretest diagnosis of favor Spitz nevus. Over 1,000 were submitted with a pretest diagnosis of favor atypical spitzoid tumor, and about 800 or so came with a pretest diagnosis of favor spitzoid melanoma.